All right, so we're looking at yet another cause of gastrointestinal bleeding. That's upper gastrointestinal bleeding. So this is variceal bleeding. Okay, so variceal bleeding is more of like esophageal varices. So when I say something is what there's varices, the veins around that place, they are kind of like dilated. All right, so the veins around that place are dilated. That's basically what we call varices. So for the variceal bleeding, if veins around a place become dilated, sometimes it can now burst up, so there can be bleeding. So of course it's a cause of upper gastrointestinal bleeding. So variceal bleeding, we say that it's a serious, it's a potential life-threatening condition. Alright, so it's a cause of upper gastrointestinal tract bleeding. It's mostly seen in patients with portal hypertension. Alright, most of the times the patient has liver cirrhosis. You can see that the patient has liver cirrhosis, where there's inflammation of the liver and all of that. The hepatocytes are getting the hepatocytes are basically becoming dead and all of that. You get. So so what are varices in the first place? They are just dilated veins. It could be in the esophagus or down to the level of the stomach. So they form when portal vein pressure increases, because causing blood to reroute through smaller vessels. So there's a whole lot of pressure on the small vessels, all right, which is not supposed to be there. Okay, so those small vessels, they are small. They can't actually bear the heavy, how will I put it, they can't bear like the weight that those big veins could be able to bear. So they can rupture, leading to massive bleeding. Okay, so why does it matter? Now, variceal bleeding accounts for a significant portion of anything upper gastrointestinal bleeding, especially in cirrhotic patients. It has a high mortality rate if not promptly treated. Bleeding typically occurs when the portal pressure gradient exceed 12 millimeter mercury. Okay, so diagnosis. They have to do endoscopy. All right, endoscopy is a nice one for this. Endoscopy is the gold standard for identifying variceal bleeding. Now, all right, they basically stratify the risks. Stratifying the risks is more of like you're trying to grade the risks to know the severity of the condition you are dealing with. So in grading the risks, they use things like the child pool or the MED score, which we'll later on be talking about. So what's the management strategies for all of this? Initial resuscitation with fluids and blood products, vasoactive agents like telepressin or octreotide to reduce the portal pressure, and the plasmic band ligation is a preferred method for esophageal varices. All right, then bleeding is here and there. You could now give some 1 or 2 rooms for infections to come in, so you use antibiotics, prophylactic. Okay, so that was it, establishing variceal bleeding as a cause of upper gastrointestinal bleeding.